Hi there, my name is Dylan. I'm going to be your student nurse today. Can you tell me your name and your date of birth? Okay, I'm going to do some hand hygiene, make sure my hands are all clean. Do you have any allergies, sir?
Nope.
No allergies? Alright, so we're going to be putting an IV into your hand today as an insertion and getting some IV fluids running. Are there any pain relief methods that you like? And if so, I can give you Emila cream, which would take about 60 minutes to activate, or LMX, which would take about 30 minutes, or I can give you some lidocaine, a lidocaine injection, or I can give you some spray, which would take a little bit to dry, but that would work as well.
No, I'm okay.
Okay, well, let's get all our supplies ready. So you don't have any allergies, anything?
Nope.
You don't want any of the pain relief, so that's good. All right, first off, I'm gonna get this Tegaderm. This is gonna be going over the top of your IV today. And I'm gonna open this up, face side up. Like that, so I'm not contaminating it at all. Okay, do some hand hygiene once again. I'm gonna get the rest of my supplies ready. This is the catheter. I'm gonna set this there for right now. And here is your tourniquet. And now, this is the saline lock. We're just gonna open this up. All right, so there's no, it is prepped and all ready to go. Now I'm going to attach this. I'm going to attach this to there. Okay. And I'm just going to put this right here. Actually, I'll put this right here for now. Not contaminated at all. Okay. And now I am going to be applying your tourniquet. And I'm going to do it about 4 to 6 inches above your hand. And I'm just going to be seeing which vein is best to use. All right, so let's see which vein is best. That one looks great. All right, so let's release this tourniquet. And now I'm going to be prepping, and I'm going to lock this. It's locked. All right. And we're going to be, I'm going to be getting some gloves on too before I do all this. So our next steps, I'm going to be cleaning your solution, and I have that face side up so it's not contaminated either. I'm going to be cleaning your IV site, and then I'm going to let that dry. And then after that, we are going to be inserting the catheter. Alrighty. So I'm going to be doing it right there. I'm not going to touch it. I can touch it right now, but I haven't done anything. So now I'm going to be cleaning it for 30 seconds, side to side, up and down. And for the sake of the video, I won't be doing it for that long. Alrighty, perfect. So now I'm gonna let that dry for a minute, and I'm gonna get your catheter all ready to go. Just gonna open it up. This is still clean and not contaminated because I have not opened up your IV. I'm just gonna sit down. It's easier for both of us. And now I'm going to be, I'm just gonna move this a little bit closer to me. Reattaching your tourniquet. All right, so now I'm gonna be opening your IV. I'm gonna move this in a 360-degree motion towards me. With my non-dominant hand, I'm going to have my hand up above here, and I'm just going to be having my hand up above here. All right, it's going to be a little bit of a poke right now. All right, and now I'm going to, with my non-dominant hand, I'm going to occlude it to make sure the IV is not infiltrated. Now with my thumb, I'm going to advance the needle. And I see a flashback of blood return, and I'm not contaminating this because I'm using my non-dominant hand. I'm going to use my thumb right here, and I'm going to take this back, advance. I did the safety of the needle, and now I am going to be attaching this. This is going to be the saline solution. Oops. In real life, that would not happen. Okay. And now we'll be attaching this. All right. So I stuck it once, and I didn't stick it multiple times for the stickiness. And now I'm going to detach the sticky pads. And I am going to use this needle, or this tape, so I can secure IV. There we go. And now I'm going to remove the IV, or saline solution, and I'm going to put this up top there. And I will use this other tape and I saw a flash, and the IV was not infiltrated or anything. I didn't see any coolness or redness or warmth around the insertion site, and the patient didn't complain of any tenderness or really terrible feeling. So the IV is secure and is ready for its solutions to go in. I'm going to remove my gloves, and I am going to take away all this stuff. I am going to be putting this into the sharps container. Hand hygiene. I'll be removing this as well. And what I did today, and I'm going to be removing the tourniquet. Obviously, I would do that before. I didn't do that initially right away, but since I acknowledged it, and also I did it probably 30 seconds later, I could have did that right when I was occluding the vein, but I did not. Yeah, and what I did today was I inserted an IV for fluids, and I didn't see any warmth or coolness, and we used a certain gauge needle for that. I'll chart that and the MAR and all that, and the patient didn't complain of any tenderness or pain, and they did not have any pain relieving methods, and I got the IV in on the first time. All right, hand hygiene, and that's it.